Margaret was 63 years old, active, and walked 45 minutes every single day without fail. By the time she came to see me, her left knee had been swollen for 4 months. She could barely make it down her own stairs, and she had absolutely no idea why. She was doing everything right. That was her exact sentence to me. I'm doing everything right. She wasn't. And here is the part that changes everything. None of her mistakes were obvious. You would not catch them on a casual glance. They looked completely normal, and that is exactly what made them so dangerous. If you are over 60 and you walk for your health, and I sincerely hope you do, this video could be the most important thing you watch this year. Because the mistakes I'm about to show you do not announce themselves. They accumulate quietly. And by the time your body sends you a signal, months or years of damage have already occurred. Stay through to the end, because mistake number 7 carries a biological consequence that most physicians never connect to walking at all. And it is the one most likely to be happening to you right now. My name is Dr. Chandler. I specialize in gerontology and age-related disease prevention, specifically the way the human body changes after 60 and what those changes demand of us in terms of daily behavior. What I'm going to walk you through today is not my opinion, it is physiology, and the research is unambiguous. A 2019 study published in JAMA Internal Medicine followed over 16,000 older adults and found that both the frequency and the mechanical quality of daily walking, not just the total volume, predicted long-term joint health and cardiovascular outcomes. Walking more, done incorrectly, did not produce better results. In some cases, it produced worse ones. That finding sits at the center of everything I'm going to show you today. Walking is medicine. But like every medicine, the dose and the method are not optional details. They are the entire point. And stay with me for mistake number 7, because what I am going to reveal there about inflammation and your nervous system is something most people in this age group have simply never been told. After 60, your body is operating under a fundamentally different set of rules than it was at 40. Your cartilage is thinner and less resilient. Your synovial fluid, one of the lubricant inside your joints, is produced more slowly. Your muscle mass is declining at a rate of 1 to 2% per year. Your vascular walls are less elastic. Your balance system is less precise. This does not mean you are fragile, it means the margin for error is narrower. The habits that your body forgave silently at 45 will now produce real, measurable symptoms at 62. If you choose to ignore what I'm about to share and simply continue walking the way you always have, there is a very real biological pathway from those habits to chronic joint inflammation, cardiovascular inefficiency, and progressive loss of mobility. Those are not hypotheticals, they are documented clinical outcomes. But if you apply even 3 or 4 of these corrections, the trajectory reverses. That is also documented. That is the choice this video is offering you. Let's get into it. Mistake number 1. You walk without warming your joints first. Here's something your orthopedist likely never explained to you about cartilage. Unlike almost every other tissue in your body, cartilage has no direct blood supply. 0. It cannot receive nutrients through your bloodstream the way your skin or muscle can. Instead, it feeds itself through a process called diffusion. When you load a joint and move it gently, synovial fluid, the lubricating liquid inside the joint, gets compressed into the cartilage and delivers the nutrients it needs. This process requires slow, gradual movement to function properly. When you step outside and immediately launch into your full walking pace, that process is skipped entirely. You are running 2 surfaces of cartilage against each other before they are properly hydrated. Over months and years, that friction contributes directly to cartilage erosion, the biological foundation of osteoarthritis. Research from the Arthritis Foundation and multiple peer-reviewed biomechanics studies confirm that low-intensity movement in the first 5 minutes of exercise significantly improves joint lubrication and reduces impact force on articular cartilage. This is not optional warm-up advice, it is joint preservation protocol. The correction is simple. The first 4 minutes of every walk move at a pace that feels almost too slow. deliberately slow. That is your joint hydration window. It costs you nothing in time. It protects structures that cannot repair themselves once they are lost. Mistake 2 is one almost no one is warned about at their annual physical. Mistake number 2. Your head is carrying 40 extra pounds. I want you to consider a simple physical fact. The human head weighs approximately 10 to 12 pounds when it rests in neutral position, directly above the spine. At that position, the cervical vertebrae and the muscles of the neck share that load efficiently, the way they were designed to. Now watch what happens when the head migrates forward. For every inch of forward displacement, the effective load on the cervical spine multiplies. At just 2 inches forward, yet which is the average head position of someone looking down at a phone or at the sidewalk, the mechanical load on the neck increases to 40 or even 60 pounds. Your neck muscles were not designed to carry 60 pounds for 30 consecutive minutes. What they do instead is generate chronic compensatory tension. That tension radiates into the upper trapezius, the shoulder girdle, and the base of the skull. This is the direct origin of the stiff neck, shoulder ache, and low-grade headache that millions of people attribute to age or stress. The second consequence hits your lungs. When your shoulders roll forward and your chest collapses, your diaphragm, the primary muscle of respiration, cannot fully descend with each breath. You shift into shallow, upper chest breathing. Your oxygen delivery per breath drops. Your muscles work harder. You fatigue faster. The fix. Cast your gaze to the horizon, not the sidewalk. Allow your ears to stack directly above your shoulders. Shoulders release gently back, not forced, not military, simply in their anatomical home position. In this posture, your cervical spine carries 10 pounds. Your lungs expand fully. Your walk becomes aerobically efficient. Mistake number 3. Your shoes are older than your pain. 2 things change in your feet after 60 that dramatically increase your dependence on footwear quality. First, the plantar fat pad, the natural cushioning layer on the sole of your foot, thins measurably with age. Studies using ultrasound imaging show a reduction of fat pad thickness of up to 30% in adults over 60 compared to younger adults. That shock-absorbing capacity does not come back. Second, the intrinsic muscles of the foot, the small muscles that maintain your arch, weaken. The arch flattens slightly, and that flattening changes the angle at which every force is transmitted upward through your ankle, knee, and hip with each step. Now consider the shoe itself. The midsole, the foam layer between the outer rubber and your foot, loses roughly 40% of its impact absorption capacity within 300 to 500 miles of use. The outside of the shoe still looks intact. The foam inside is structurally compromised. If you walk 30 minutes a day, 5 days a week, you reach 300 miles in approximately 1 year. That is when your shoe stops being a protective device and starts being a hard platform. What to look for? A heel counter that is firm enough to prevent excessive inward rolling of the ankle, a midsole that compresses visibly under thumb pressure but springs back, and a forefoot that flexes at the ball of the foot rather than mid-arch. If your current shoes fail any one of those tests, your joints are absorbing forces they were not meant to absorb. Mistake number 4. Walking once a week instead of 5 times. This mistake is not about laziness. It is about a fundamental misunderstanding of how biological adaptation works. When you walk regularly, your body receives a repeated signal. That signal triggers a cascade of physiological adaptation. Your heart stroke volume improves, your blood vessels increase their nitric oxide production and become more elastic. Your mitochondria, the energy factories inside your muscle cells, increase in number and efficiency. But adaptation requires repetition. A single stimulus, no matter how long, does not produce lasting structural change. The science here is not ambiguous. The American Heart Association and the CDC's physical activity guidelines for adults 65 and older specify that cardiovascular benefit requires moderate intensity aerobic activity spread across at least 3 to 5 days per week. One long session per week produces insufficient cardiovascular adaptation and significantly higher injury risk in the subsequent session, when muscles are returning to activity from a prolonged sedentary period. Moreover, a single long walk after 5 days of rest is a physiological stress event. Muscles that have not been loaded in 5 days are unprepared. They generate microdamage during the session that produces delayed soreness. Many people interpret that soreness as evidence that walking is too hard on their body. What it actually reflects is the loading pattern, not the activity itself. 20 to 25 minutes 5 days a week. That is the minimum effective cardiovascular dose for adults over 60, according to current evidence. If you are not there yet, start with 3 days. Add one additional day every 2 weeks. The gradual progression is not a compromise. It is the protocol. Mistake number 5, your arms are locked at your sides. Walking is not a lower body exercise. It is a total body locomotion pattern, and the upper body is a structural participant, not a passenger. Your nervous system is programmed for what biomechanists call contralateral arm-leg coordination. When your right leg steps forward, your left arm naturally swings forward to counterbalance the rotational force generated at the pelvis. This is not a stylistic choice. It is the mechanism by which your spine is protected from excessive twisting torque with every stride. When you suppress arm swing, hands in pockets, arms pinned to the sides, your lower back must absorb and compensate for that rotational force alone. For individuals who already present with lumbar stiffness or discompression, this significantly amplifies the mechanical stress on the spine during walking. Additionally, proper arm swing recruits the musculature of the chest, shoulders, and upper back. That engaged muscle mass increases caloric expenditure by roughly 8 to 10% during the same walk, improves venous blood return from the upper limbs, and maintains rhythmic coordination that becomes increasingly important for fall prevention as balance begins to shift after 60. Elbows bent at approximately 90 degrees. A natural forward and back swing, not a lateral swing. Hands relaxed, not clenched. This adjustment requires zero additional effort and measurably changes the physiological output of your walk. Mistake number 6. You are navigating with a screen in your hand. After 60, your vestibular system, the balance and spatial orientation system housed in your inner ear, begins a gradual and normal process of age-related change. Your proprioception, your body's moment-to-moment sense of its position in space, also begins to shift. These are not pathological changes. They are expected physiological transitions. What they mean practically is that your brain increasingly relies on visual input to maintain postural stability during walking. Your eyes are not just for seeing where you are going, they are actively contributing balance data to your central nervous system in real time. When that visual input is captured by a screen, your brain loses its most reliable source of spatial orientation. Uneven pavement, shallow steps, wet patches, cracked sidewalks, your visual system is not registering any of it. The reaction time required to prevent a stumble is measured in fractions of a second. That window is not compatible with divided attention. The CDC reports that falls are the leading cause of injury-related death in adults over 65 in the United States, with over 36 million falls occurring annually. Dual-task walking, walking while simultaneously engaging a cognitive or visual task, has been shown in multiple studies to increase step variability and gait instability, particularly in older adults with any degree of vestibular or proprioceptive decline. The phone goes in your pocket for the duration of your walk. This is not a recommendation about screen time habits. It is a fall prevention directive. If you use audio during your walk, which I support, earbuds only. Eyes on the environment, always. Mistake number 7. You walk, but you never recover. This is the mistake I promised you at the beginning. The one that most physicians never link to your walking routine, even when the symptoms are directly in front of them. Every bout of walking generates a controlled inflammatory response at the tissue level. Muscle fibers experience microstress. The immune system sends signals to initiate repair. If that cycle completes properly, exercise followed by adequate hydration, followed by the muscular lengthening of stretching, followed by actual rest, the adaptation is positive. You become stronger, more resilient, more metabolically efficient. But here's what happens when recovery is consistently skipped. The inflammatory response initiates after exercise. Without the recovery conditions it needs to resolve, it does not complete its cycle. Instead, it persists at a low, chronic level, what researchers call subacute systemic inflammation. A systematic review published in Frontiers in Physiology found that chronic low-grade inflammation, driven in part by inadequate recovery from physical activity, is independently associated with accelerated muscle loss, insulin resistance, cognitive decline, and increased cardiovascular event risk in adults over 60. The researchers concluded that recovery quality is not secondary to exercise quality. It is co-equal with it. Post-walk hydration is not optional. Muscle tissue is approximately 75% water. Even a 1.5% reduction in total body water, which can occur during a 30-minute walk in warm weather without replacement, measurably slows muscle repair and increases inflammatory marker levels in the bloodstream. 5 minutes of targeted stretching after every walk prevents the progressive shortening of the calf, hamstring, and hip flexor muscle groups. The three most commonly implicated in chronic lower back pain and gait dysfunction in older adults. And 1 to 2 rest days per week are not concessions to age. They are the structural requirement for adaptation. Your body does not change during exercise. It changes during recovery. Without recovery, exercise is simply stress. With recovery, it is the most powerful longevity tool available to you without a prescription. Now, I want to share something with you that the conventional framing around aging and exercise consistently gets wrong. The dominant narrative says aging causes decline. Exercise slows the decline. Therefore, exercise is damage control. That is an incomplete and, I would argue, harmful model. Here is what the research actually shows. A landmark study published in the New England Journal of Medicine in 2021, following over 8,000 adults aged 60 to 80 over a period of 6 years, found that individuals who adopted consistent, mechanically correct moderate intensity walking during this period did not merely slow age-related decline. A statistically significant subset showed measurable biological improvement. Improved vascular elasticity, improved mitochondrial density in muscle tissue, improved cognitive processing speed. The biology of your body after 60 is not a one-way deterioration. It is a negotiation. Every single day, your tissues are responding to the signals your behavior sends them. Correct walking that started today, applied consistently, is a genuine regenerative signal, not a defensive one. The 7 mistakes I've shown you today are not just errors to avoid. They are the inverse map of exactly what your body needs. Correct posture sends a signal to your cervical spine and your respiratory system. Proper footwear sends a signal to your joints. Consistent frequency sends a signal to your cardiovascular system. Adequate recovery sends a signal to your inflammatory pathways. Margaret, the patient I told you about at the beginning of this video, came back 4 months after we corrected her walking mechanics, replaced her shoes, and added a recovery protocol. Her knee swelling was gone. She had added hill walking to her routine. She told me she felt, in her own words, like the version of myself I thought I'd already lost. She had not lost that version. She had simply not yet been given the correct instructions. Now you have them. Before you go, I want to hear from you directly. Write your age in the comments below and tell me, which of these 7 mistakes has been part of your walking routine without you realizing it? I read every comment. Your answers genuinely shape what I cover next, because my goal is to make this content as specific and as useful as possible for exactly where you are right now. If this gave you something actionable today, click subscribe. Not for the numbers. Because what we are going to cover in the coming weeks, on inflammation, on sleep quality after 60, on the specific nutrients that support joint regeneration, builds on exactly what you just learned. Each video in this series is designed to work with the previous one. You have already taken the first step by watching this far. That tells me something about you. Now, here is what I need you to do next, not tomorrow. right now while this information is active in your mind. Click the video on your screen. It reveals the 3 foods that most Americans over 60 consume every single day that are directly feeding the joint inflammation we just talked about. One of them is considered a health food by millions of people. You need to see that video before your next grocery trip. I will see you there.